Good morning, welcome back to my channel. As you saw from the title, today's video is going to be a 4-week post-hysterectomy checkup video. So I'm gonna get in and tell you all about how I'm feeling, everything that's happened so far, and today I also have an in-person appointment, which is the perfect timing because last night I did not have the greatest night. I had a lot of cramping for the first time since not taking any heavy pain medication. So I'm just gonna get dressed really quick and then I'm gonna take you all along to my doctor's appointment. I will film anything that she allows me to, and then I will kind of give you guys some updates on where I'm at with everything. I don't really have a ton of time. I'm just trying to throw myself together super quickly. Because I didn't have the greatest night, I did not wake up on time. I did want to blow dry my hair after I got out of the shower today. It's another super cold day out. I think it's only like 10 degrees, but I'm just gonna throw on my Clean and Clear dual moisturizer on my face. I really like this one. It does have salicylic acid in it, which is also supposed to help prevent breakouts. And then I normally only use this at night, but it is a little drier around my mouth nowadays, but it's like the Palmer's Skin Therapy Oil, like rosehip oil. Just a little bit of this around my mouth, a little bit. It definitely goes a long way. I have a little extra, might as well. When you put too much, it definitely is visibly oily and I don't want that. For my hair, I did just wash my hair. Just gonna throw a little bit of my Olaplex. I think this is like number 6. It's like the leave-in conditioner. Not sure why it's not coming down. I actually haven't used this in a while. I misplaced it. I found it in one of my luggages when I was cleaning. I'm supposed to use like a dime amount, but I do tend to definitely use way too much leave-in conditioner. I actually only try to use like those better products when I do need to blow dry my hair. That way it comes out better. And then like for every day, I typically would use like it's like a bright green bottle, the Garnier Fructis leave-in. I really like the way that smells, gives my hair a really good sheen. All right, now that my hair is all set and I think my oil is set in a little bit, I'm just gonna throw on some L'Oreal Lumi Glow to my face. Really like how it kind of gives like the illusion of that summer glow. I'm not sure if it's supposed to be rubbed all over the face, but I'm equally pale everywhere, so that's what we're doing. And then I do use the NARS Radiant Concealer. I do just use a little bit right here. That's kind of just where I have my like darker circles. It's definitely getting a lot better. I've been using a serum. Who is it by? By The Ordinary, and it's just something that you kind of just place on your under eyes at night, and then like after a different cream, and you're not supposed to rub it in. I'm not really sure why. It says to just press it in. So that's kind of it. I'm gonna throw some mascara on, and then we're gonna throw some clothes on and be out the door. All right, that is all done. I almost completely forgot about my eye gel. Doing it backwards. comes out like way too much. And if I were to put all of that on my eyebrow, it would actually look white. So I have to like scrape a lot of it off. I know I showed this one in like my get ready video, and I do use it all the time. It's kind of just to mimic your brows of how they come out when you get them laminated. How I had them before, it's definitely worn off. I'm honestly not even sure, like if you want to keep it up, I'm not sure how often you're actually supposed to do it, because I tend to just go on the random times and get it done when I'm getting my hair blow dried or like getting some type of hair service as an add-on while I'm at the salon. All right, this is it. This is my everyday look. Somehow I got mascara all over my hands. All right, let's go get changed. I am so over this little Arctic blast that we're having currently. It is 8 degrees outside with a feel like temperature of 2. The second I opened my door to come outside to leave for this appointment, I closed it. Like, it was such a shock to my senses. And then I took a breath and was like, okay, here we go. This is definitely not the place that I thought I was going to be doing my 4-week post-op update from, but it's very realistic. After the doctor's appointment that I had already scheduled, I was getting some really bad stomach pains. As I said in the video when I was getting ready this morning, I had some pains that I just could not shake. This is definitely not the place that I thought I was going to be doing my 4-week post-hysterectomy update from, but it's very realistic. I am at Women and Infants in the emergency room. As I said in the intro this morning, I was having some really bad pains last night, like just really bad cramping, and when I first woke up this morning, the pain was there, but it was very bearable, to the point where I had just taken some Tylenol and I assumed that that was going to help. I went to the appointment, and as I was sitting there talking with her, the pains came back. It was way worse. I was having like a sharp shooting pain. My back is now hurting. I'm nauseous. So her office was right around the corner from Women and Infants Hospital. So when we were done going over a couple of things, she did have me come here. I've been waiting for a little bit to probably have like a pelvic exam. I haven't had one yet since the surgery and a possible ultrasound to see what's going on. So after that, I guess I'll check back in and give you guys an update on what's happening inside my stomach. I'm hoping that it's nothing serious that I have to have any kind of other surgeries today. I've been at the hospital now for a little over 5 hours. I ended up giving some blood samples, a urine sample, and had a CAT scan. I am still waiting on my pelvic exam. I'm not really sure how long all of the results for everything will be. I did see some results pop up on my lab chart, like the actual app MyChart that I'm registered for, but I don't really know what any of it means. A bunch of the urine samples did come back as abnormal. I don't really understand what I was reading, so hopefully a doctor will come in soon and explain all of that to me, and I'm really hoping that I can leave home today with, a good solid reason as to why I'm feeling the pain that I am. And again, still hoping that it's nothing serious. So I finally left the hospital. I ended up being there for 6 hours. I'm very grateful. I did get an explanation of the pain, and thankfully it was nothing that required a surgery or a hospital stay. I did have 2 cysts that burst on my right ovary, and honestly I was a little shocked. I didn't even know that that was something that was going to continue after having a hysterectomy. That was definitely something that I've had a lot of issues with in the past, especially when I was on birth control. I used to get cysts that would grow and burst all the time. It is an excruciating pain, but it explains a lot of, like, as to the way that the pain was coming in and the way it felt like it was moving, or like how it was sharp and if I was a certain way or whatever. But as soon as I got that explanation, I basically didn't have to stay much longer than that. The doctor just came in and, told me I'm going to continue on the same medications that I already have. I do still have some oxys left. They did say that that should definitely cut out the pain because taking Tylenol or ibuprofen did not help. As far as a 4-week update, that's the start of it. Basically, I had 2 cysts that ruptured on the one ovary that I have. Lucky me. I'm definitely able to walk a lot better prior to these cysts bursting. I do have to rest for about 3 days now, which I'm definitely okay with. My body needs to heal. I don't want to be in any pain, don't want to upset anything else. But after that, I can get back to walking 30 to 60 minutes at a slower pace. Still not supposed to lift over 10 pounds at least for another 4 weeks or so. My migraines are still there. They are just as prevalent from day one as they are now. It hasn't gotten any better. My doctor did send over a new prescription medication for that, which I haven't tried yet. I'll probably have to take that today because I have the worst migraine, and they did give me medication while I was at the hospital, but it didn't help at all, and that was the issue that I was having, that Tylenol and ibuprofen, and they gave me Toradol. It didn't help. So hopefully the new medication helps. When the pain kind of is worse later on, I probably will take an oxy since I won't be going anywhere. I'll be at home in bed for the night. I'm sorry, I do feel a little off. I'm definitely fine to drive, but just my train of thought is just way off from having such a bad migraine. I'm not really sure if I went over this in any of my previous videos, but I did have everything removed except for one ovary. That was kind of what my doctor and I had decided was going to be best for me. I do still have the right one, the left one. I had some fibroids, I had some cysts, and I unfortunately did have a tumor, which is ultimately what the rush was for. Having my hysterectomy at such short notice. I always knew I was going to have it. Okay, I'm back. So sorry about that. I had to come in the house. I don't know why I was sitting in the car for so long, but basically what I was getting into was my surgery was short notice because of the tumor, but I had been planning on having it. I just was expecting it to be a couple of months out. So that is that. But the good news is the pathology report from the surgery did come back last week. There ended up being 2 tumors, which no one had really gone over with me. I guess it was something that they did tell my husband when they had given him a call after I woke up after the surgery. I'm not really sure if they could have told me, to be honest, but I was so out of it, I just don't remember. But I did see it on there. They were both non-cancerous, so I was very excited about that. I'm not really sure what would have happened if they had come back positive in that way, but
Thankfully, that was not the case. One of the things that I had gone over with my doctor at the appointment today before I ended up going to the emergency room was the fact that I was technically supposed to have like a combined surgery originally. I do need to have a sling put in. It is something that I was always super embarrassed to talk about before, but honestly, I shouldn't have been, because a lot of women go through this after they have kids, and a lot of times it goes away and gets better, but for me, it didn't. I had a lot of bad stress incontinence. So for anyone who is not familiar with what that is, if I would laugh hard enough, I would pee. If I would cough, if I would sneeze, if I would sit down too hard, sometimes when I worked out, I would pee my pants. And it just got to the point where I'd been with it for so long and just kind of going through the motions of, maybe always having an extra pair of panties or pants or wearing a panty liner with me. Like, it just became my new normal. But realistically, like, I'm not even 40 years old, so that's not normal. So I will have to have another surgery. I'll actually know within the next 2 weeks the specific date for that. I'm hoping to kind of just tackle it while I'm already out of work. I don't really want to go through the full healing process and then have to start it all over again. I'd rather just get it out of the way now, especially since summer's coming up. And my husband and I were finally looking forward to taking our honeymoon this summer. So I really just want to get any type of healing out of the way now. Well, it's winter and I'm stuck in the house anyway. So with the exception of having the ruptured cyst, I honestly haven't been feeling too bad as far as like my pain level goes. I will say I am way more tired than I ever thought I could be from doing nothing. I am doing like little things here and there around the house. I take lots of breaks. I sit down a lot. I'm not standing for more than, I'll say, 10 to 20 minutes tops, unless I'm purposely walking on the treadmill. That's kind of the only time that I'm walking. That I'm standing for longer than that time period. But, everybody's experience is different. I've known multiple people to have this surgery, and some have felt a lot worse than I do at this point, and some a lot better. I've known some people to just be back at work, but my doctor said absolutely not. My job is definitely stressful on the body. I'm standing for 12 hours at a time, going up and down stairs. I actually recall plenty of times that I would hit around 18,000 steps just in my one shift. So that isn't really the greatest idea to go try to jump right back into that. So yeah, my biggest takeaways are how tired I am, my headaches, the cramping that I was having, from the heavy periods, and endometriosis and admiosis. That's definitely subsided for the most part. So those are all the updates that I have for now. Stay tuned, and I do have some more appointments coming up, and I will let you know how it's going.